Is your heart silently crying for help right now? According to the American Heart Association, cardiovascular disease kills one person every 36 seconds in the United States alone. That's over 2,400 deaths every day. And the most frightening part, many victims never saw it coming because they missed the warning signs their bodies were desperately trying to show them. Today, I'm going to reveal the 7 visible signs on your body that may indicate your heart is in trouble, followed by the 7 symptoms you should never ignore. By the end of this video, you'll know exactly what to look for and how to protect yourself. This could literally save your life or someone you love. When your heart begins to weaken or dilate, it struggles to pump blood efficiently. The result? Fluid buildup in your lower extremities. You might notice your shoes suddenly feel tight. Your socks leave deep impressions on your skin, or your ankles look puffy like freshly rising bread dough. This isn't just normal fatigue, it's your body waving a red flag. This swelling, medically known as edema, happens because a weakened heart can't pump blood effectively against gravity. By the end of the day, the fluid that should be circulating through your body instead pools in your legs and feet. When you press on this swollen area, it leaves a dimple that doesn't immediately bounce back. We call this pitting edema, a classic sign of heart failure. The good news? If caught early, this condition can often be managed. Elevating your legs above heart level when you rest, reducing salt intake, and working with your doctor on a treatment plan can help manage this symptom and protect your heart function. A landmark. Framingham Heart Study followed over 5,000 participants and found that unexplained leg edema was associated with a nearly 30% increased risk of developing heart failure within 5 years, especially in people over 40. I remember a 56-year-old teacher who came to me complaining her shoes no longer fit by the end of the school day. She thought it was just aging, but further testing revealed early-stage heart failure. By starting appropriate treatment and making lifestyle changes, her swelling resolved and we prevented a potential cardiac emergency. Imagine having painful sores on your legs or feet that simply refuse to heal despite weeks or months of treatment. These stubborn ulcers aren't just frustrating. They could be telling you that blood isn't reaching these areas properly due to serious circulatory problems that may also affect your heart. These non-healing ulcers develop because arterial blockages prevent oxygen-rich blood and nutrients from reaching your skin and tissues. Without proper blood flow, your body's natural healing mechanisms fail. What's critical to understand is that if you have blockages in your leg arteries, you likely have them elsewhere too, including the coronary arteries feeding your heart. Treating these ulcers requires addressing the underlying circulation problem. A vascular specialist can perform tests to measure blood flow and determine if interventions like stenting are needed. Meanwhile, specialized wound care, compression therapy when appropriate, and rigorous infection prevention are essential. Research published in the Journal of Vascular Surgery shows that patients with arterial leg ulcers have a 3 to 5 times higher risk of coronary artery disease and heart attacks compared to the general population. One of my patients ignored a small wound on his heel for months. By the time he sought help, the ulcer was infected. During treatment, we discovered severe arterial blockages not just in his legs, but also in his coronary arteries. A cardiac evaluation revealed he was at imminent risk for a heart attack. Early intervention with stents potentially saved his life. Imagine looking down at your fingers or toes and seeing them turn an alarming shade of blue or purple. Not because of cold weather, but because your tissues are literally starving for oxygen. This bluish discoloration, called cyanosis, can be a critical warning that your heart or lungs aren't functioning properly. Healthy, well-oxygenated blood is bright red, giving our skin its normal pinkish tone. When tissues don't receive enough oxygen, either because the heart isn't pumping effectively or the lungs aren't properly oxygenating the blood, Hemoglobin in your blood changes color, giving skin that characteristic bluish tint. It's like a visual oxygen meter on your body. Cyanosis requires immediate medical attention. Depending on the cause, treatments may include oxygen therapy, medications to improve heart function, or procedures to address structural heart problems. The key is not to ignore this dramatic warning sign. Studies from the American College of Cardiology show that central cyanosis, affecting the lips, tongue, and trunk, is associated with significantly reduced oxygen saturation levels and can indicate heart defects or severe heart failure with mortality. Rates up to 50% higher if left untreated. I once had a patient who noticed her lips turning blue during mild exercise. She initially brushed it off as being out of shape. When she finally came in, we discovered a congenital heart defect that had gone undiagnosed for 40 years. After surgical correction, her cyanosis disappeared, and she could exercise without fear for the first time in her life. Imagine looking in the mirror one day and noticing a white or grayish ring forming around the colored part of your eye. This isn't just a cosmetic change. It could be your eyes revealing a dangerous secret about your heart health. Especially if you're under 45, this ring, called corneal arcus or arcus senilis, is caused by cholesterol deposits around the edge of your cornea. While it's common and generally harmless in older adults, finding this in someone younger than 45 is concerning because it may signal dangerously high cholesterol levels, the same cholesterol that could be building up in your arteries and threatening your heart. If you notice this ring, especially if you're younger, get your cholesterol levels checked immediately. Lifestyle changes like diet modification, exercise, and possibly medication can help lower cholesterol levels and reduce your cardiovascular risk. Research in the British Journal of Ophthalmology found that premature corneal arcus before age de 50 was associated with nearly 3 times the risk of developing coronary artery disease compared to those without this sign. A 38-year-old man came to me after his optometrist noticed corneal arcus during a routine eye exam. Tests revealed his LDL cholesterol was dangerously high at 260 mg/dL. Further investigation uncovered significant coronary artery narrowing that required immediate intervention. His eye literally saved his heart. Those small, slightly raised, yellowish patches near the inner corners of your eyelids might seem like just an annoying cosmetic issue. But these harmless-looking deposits, called xanthelasma, could be signaling that your arteries are silently filling with dangerous plaque, setting the stage for a heart attack or stroke. Xanthelasma are actually cholesterol deposits that form under your skin. They're particularly telling because they're visible evidence that cholesterol is accumulating in your body. While only about half of people with xanthelasma have measurably high cholesterol on blood tests, studies show they still face a significantly higher risk of heart disease, regardless of their blood test results. If you notice these yellowish deposits, consider them your early warning system. Get comprehensive lipid testing, including advanced cholesterol panels that measure particle sizes. Work with your doctor on aggressive risk factor management through diet, exercise, and possibly medication. Landmark Danish study published in the British Medical Journal followed 12 onset of in 45 individuals for 33 years and found that people with xanthelasma had a 48% increased risk of heart attack and a 39% increased risk of ischemic heart disease, even after adjusting for other risk factors. A 42-year-old woman consulted a dermatologist about removing xanthelasma for cosmetic reasons. Fortunately, the dermatologist recognized their significance and referred her for cardiac evaluation. Despite having only mildly elevated traditional cholesterol numbers, advanced testing revealed dangerous cholesterol particle patterns. Starting, early treatment potentially prevented a heart attack that might have been just years away. Have you noticed the hair on your lower legs mysteriously disappearing, first on your shins and later possibly on your thighs? Many dismiss this as normal aging or friction from clothing, but this seemingly innocent change could be revealing a dangerous secret. Your leg arteries are narrowing, and your heart arteries might be too. Hair follicles need adequate blood flow and nutrients to produce hair. When arteries in your legs become narrowed or blocked by atherosclerosis, plaque buildup, blood flow diminishes, and hair follicles literally starve. This condition, peripheral arterial disease, rarely occurs in isolation. If you have atherosclerosis in your legs, it's likely developing throughout your body, including the critical coronary arteries that feed your heart. If you've noticed unexplained hair loss on your legs, especially if it's accompanied by smooth, shiny skin or slow-growing toenails, talk to your doctor about peripheral arterial disease. Screening. Simple tests like the ankle brachial index can detect circulation problems early, when intervention is most effective. Research from the Mayo Clinic found that 60–80% of patients with significant peripheral arterial disease also have coronary artery disease, and their risk of heart attack and stroke is 5 to 6 times higher than those without PIAD. I remember a 55-year-old runner who was puzzled by hair loss on one leg but not the other. This asymmetry prompted investigation that revealed a 90% blockage in his femoral artery. Further testing showed moderate coronary disease as well. With medication, lifestyle changes, and one stent placement, he returned to running and potentially avoided both a heart attack and a dangerous leg amputation. This might sound unbelievable, but the next time you look in the mirror, pay special attention to your earlobes. A diagonal crease across your earlobe, known as Frank's sign, could be quietly warning you about coronary artery disease. It seems strange that your ears could know something about your heart, but numerous studies have confirmed this surprising connection. While scientists aren't completely certain why this correlation exists, the leading theory suggests that the same factors that damage the delicate lining of your coronary arteries also affect the small blood vessels in your earlobes. Both your earlobes and your heart arteries contain end arteries with similar microvascular structures, potentially making your earlobe a visible window into your coronary health. If you notice this diagonal earlobe crease, especially if you're under 60, it's worth mentioning to your doctor. It doesn't guarantee you have heart disease, but it may warrant further cardiac risk assessment, especially if combined with other risk factors like high blood pressure, diabetes, or family history. A comprehensive meta-analysis published in the Archives of Medical Science reviewed 37 studies with over 31,000 participants and found that Frank's sign was associated with a 3.3-fold increased risk of coronary artery disease. The younger the person with this sign, the stronger the correlation. I had a healthy-appearing 48-year-old patient who came in for a routine physical. During examination, I noticed prominent bilateral earlobe creases. Though he had no symptoms, I recommended a cardiac calcium score test based on this finding, plus his family history. The test revealed significant early coronary disease that we were able to address years before it might have caused a heart attack. Today, he credits his earlobes with saving his life. Now that you know the 7 visible signs that could be warning you about heart problems, let's move to something equally important, the 7 symptoms you may be feeling but dismissing. These symptoms are your body's way of sounding the alarm when your heart is struggling. Recognizing them early could be the difference between life and death. Imagine climbing a flight of stairs you've climbed hundreds of times before, but suddenly finding yourself gasping for air halfway up. Or perhaps you're walking through a grocery store and need to stop and catch your breath between aisles. Many dismiss this as simply getting older or being out of shape, but this disproportionate breathlessness could be your heart desperately trying to tell you something is wrong. When your heart weakens or your arteries narrow, it struggles. to pump enough blood to meet your body's increased oxygen demands during activity. Your body responds by breathing faster and deeper to try to compensate, creating that feeling of breathlessness. It's like trying to water a garden with a kinked hose. No matter how much you turn up the faucet, not enough water gets through. Don't normalize progressive shortness of breath. If you notice this symptom, especially if it's new or worsening, talk to your doctor about cardiac testing. Options like echocardiograms, stress tests, or even coronary calcium scans can identify problems before they become emergencies. Research from the Framingham Heart Study found that unexplained dyspnea, shortness of breath, during mild exertion was associated with a 4-fold increased risk of developing heart failure and a 2-fold increased risk of fatal coronary events over a 12-year follow-up period. A 62-year-old professor initially blamed his increasing breathlessness on age and weight gain. When he finally mentioned it during a checkup, we discovered moderate heart failure. With appropriate medications and cardiac rehabilitation, his breathing improved dramatically, and he avoided what could have been a catastrophic decline in his heart function. Today, he can play with his grandchildren without stopping to catch his breath. A persistent cough that won't go away despite cough medicine, antibiotics, or time should never be dismissed as just a lingering cold. When this cough produces white or pink-tinged frothy sputum, it's particularly alarming. Your lungs could be filling with fluid because your heart isn't functioning properly, a dangerous situation that demands immediate attention. This type of cough occurs when fluid backs up from your heart into your lungs, a condition called pulmonary edema. As your weakened heart struggles to pump effectively, pressure increases in the blood vessels of your lungs, forcing fluid into the air spaces. This creates the distinctive frothy sputum, sometimes tinged pink from small amounts of blood. It's like a dam breaking and allowing water to flood areas that should remain dry. If you're experiencing a persistent cough with these characteristics, seek medical attention immediately. Treatment typically includes medications to strengthen heart contractions, remove excess fluid, and reduce the workload on your heart. The right intervention can dramatically improve both symptoms and prognosis. According to the American Heart Association, pulmonary edema, indicated by this distinctive cough, is associated with a 30-day mortality rate of up to 15% if not promptly treated. Conversely, early intervention can reduce this risk to under 5%. I remember a 58-year-old woman who thought her persistent cough was due to allergies or asthma. She had been treating herself with over-the-counter medications for weeks. When she finally sought medical care and mentioned the frothy, occasionally pink-tinged sputum, we immediately performed diagnostic tests that revealed heart failure. Within 48 hours of starting appropriate treatment, her cough had virtually disappeared and her heart function began improving. Imagine this frightening scenario. You lie down to sleep, but feel like you're suffocating. You add pillows, eventually, needing to sleep sitting upright in a chair just to breathe. Or worse, you wake up in the middle of the night gasping for air, feeling like you're drowning. These terrifying experiences aren't just sleep disturbances, they're classic warning signs of heart failure that should never be ignored. When you lie flat, fluid that has pooled in your lower body during the day redistributes throughout your body, including your lungs. A healthy heart can handle this fluid shift, but a failing heart cannot prevent fluid from accumulating in your lungs, making breathing difficult or impossible when lying down. This is orthopnea. Paroxysmal nocturnal dyspnea occurs when this fluid buildup reaches a critical level after you've been asleep for a while, triggering that panicked awakening. If you find yourself needing multiple pillows to breathe comfortably, or experience frightening nighttime awakening with shortness of breath, seek medical evaluation promptly. Heart failure treatments, including medications that reduce fluid buildup and strengthen heart contractions, can dramatically improve these symptoms and your quality of life. Research published in the European Journal of Heart Failure found that patients experiencing orthopnea were 2.3 times more likely to have heart failure than those without this symptom. When combined with other symptoms, the diagnostic accuracy increases to over 90%. A 65-year-old retiree gradually progressed from sleeping with one extra pillow to sleeping in his recliner chair. When his wife insisted he see a doctor after witnessing him wake up gasping for breath, we diagnosed advanced heart failure. With proper medication adjustment and fluid management, he was back to sleeping comfortably in his bed within weeks. "I didn't realize how serious my sleeping problems were," he admitted. "I thought it was just old age." The exhaustion that comes with heart problems isn't your typical end-of-day tiredness. It's a profound, persistent fatigue that makes even simple tasks feel impossible. Imagine struggling to carry groceries, feeling winded while brushing your hair, or needing to rest after a short walk to the mailbox. When your heart isn't functioning properly, every cell in your body feels the impact. Your heart is your body's oxygen delivery system. When it weakens or becomes inefficient, your muscles and organs receive less oxygen and nutrients than they need to function properly. This creates energy deficits throughout your body, manifesting as extreme fatigue and weakness. It's like trying to run a high-performance vehicle on a nearly empty gas tank. Even basic functions become difficult or impossible. If you're experiencing unusual fatigue that doesn't improve with rest, especially if accompanied by other symptoms, we've discussed consult your doctor about cardiac testing. Treatments ranging from medications to pacemakers to lifestyle modifications can improve heart function and restore your energy levels. Research from the Heart Failure Society of America shows that fatigue is present in over 90% of heart failure. Patients and improvement in this symptom strongly correlates with successful treatment outcomes and better quality of life. A 59-year-old small business owner attributed her increasing fatigue to stress and aging. She started taking afternoon naps, then found herself needing to sit down while cooking dinner. When her weakness prevented her from playing with her grandchildren, she finally sought medical help. A simple echocardiogram revealed significantly reduced heart function. With appropriate heart failure treatment, her energy steadily returned. 6 months later, she was back to her active lifestyle, wondering how she had normalized such extreme fatigue. If you find yourself repeatedly getting up throughout the night to urinate, sometimes 3, 4, or even 5 times, you might assume it's just an inconvenient bladder issue or aging. But this disruptive pattern, called nocturia, could actually be your heart sending an urgent message that it's struggling to function properly. During the day, gravity pools fluid in your legs and feet. When you lie down at night, this fluid redistributes into your bloodstream. A healthy kidney can handle this increased fluid load, but when your heart is failing, it triggers your kidneys to eliminate excess fluid to reduce the workload. This produces the frequent nighttime urination. It's your body's way of trying to compensate for a struggling heart. If you're experiencing nocturia without other obvious causes, like excessive evening fluid intake or certain medications, discuss it with your doctor. Simple tests can determine if it's related to heart function. If heart issues are detected, treatments ranging from diuretics with specific timing to other heart failure medications can help regulate fluid balance and reduce nighttime bathroom trips. A study in the Journal of Cardiac Failure found that nocturia occurring 2 or more times per night was associated with a 2.7-fold increased risk of having undiagnosed heart failure in patients over 50. A 72-year-old retired engineer was frustrated by his nightly pattern of waking 4 or 5 times to urinate. His primary doctor had tried various bladder medications without success. When he mentioned mild ankle swelling during a follow-up, we connected the dots and ordered cardiac testing, revealing moderate heart failure. With appropriate heart medication adjustments, his nocturia improved dramatically to just 1 bathroom trip per night and his overall energy improved as well. Imagine taking a walk and consistently developing an aching, cramping pain in your calf muscles that forces you to stop, only to have the pain disappear when you rest and return when you start walking again. Many dismiss this as muscle cramps or arthritis, but this distinctive pattern, called intermittent claudication, signals a dangerous circulation problem that often accompanies coronary artery disease. This pain occurs because your leg muscles aren't receiving enough blood to meet the increased oxygen demands during exercise. The narrowed or blocked arteries in your legs, peripheral artery disease, prevent adequate blood flow, causing pain similar to angina in the heart. What's crucial to understand is that atherosclerosis is typically a systemic disease. If you begin to have blockages in your leg arteries, you likely have them in your coronary arteries too. If you experience predictable leg pain when walking that resolves with rest, don't dismiss it. Consult a doctor for evaluation of peripheral artery disease. Treatments range from supervised exercise programs and medications to procedures that restore blood flow. Addressing this issue not only improves walking ability but can identify cardiac risk-requiring intervention. Research from the American College of Cardiology shows that patients with intermittent claudication have a 3 to 5 times higher risk of dying from cardiovascular causes compared to people without this symptom. Early intervention can significantly reduce this risk. A 67-year-old avid golfer noticed he could no longer complete even 9 holes without leg pain forcing him to stop and rest. After reading about intermittent claudication, he sought medical attention. Testing revealed not only peripheral artery disease, but also significant coronary blockages that weren't yet causing symptoms. Following stent placement in both leg and heart arteries, he returned to the golf course without pain and potentially avoided a future heart attack. Chest pain is the most recognized heart symptom, yet it's still frequently dismissed or misinterpreted. This isn't always the dramatic crushing pain portrayed in movies. It can be subtle, pressure, tightness, squeezing, or burning that comes and goes. Some describe it as feeling like a heavy weight on their chest or a tight band around their torso. Never gamble with chest discomfort. It could be the final warning before a catastrophic heart attack. This pain, called angina, occurs when your heart muscle doesn't receive enough oxygen-rich blood due to narrowed or blocked coronary arteries. During physical or emotional stress, your heart requires more oxygen, but compromised arteries can't deliver it, causing pain signals. It's like a car engine overheating when pushed too hard with a partially clogged fuel line. Stable angina follows a pattern and resolves with rest, while unstable angina is more unpredictable and dangerous. Any chest discomfort, especially if accompanied by shortness of breath, sweating, nausea, lightheadedness, or pain radiating to the jaw, neck, shoulder, arm, or back, requires immediate medical attention. Don't try to self-diagnose. Call emergency services. Modern treatments can save heart muscle if administered quickly enough. For chronic stable angina, medications and procedures can improve blood flow and quality of life. Studies from the New England Journal of Medicine show that half of heart attack victims experience warning chest pain episodes in the days or weeks before their heart attack. Recognizing and responding to these warnings can reduce heart attack mortality by up to 47%. Deutsch Gauam. A 54-year-old executive experienced intermittent chest pressure while climbing stairs that would resolve after resting. He attributed it to indigestion and stress for several weeks. When the episodes became more frequent, his wife insisted he visit the emergency room. Testing revealed severe blockages in 3 coronary arteries, requiring immediate bypass surgery. His cardiologist later told him he had been walking around with a time bomb in his chest. Today, he shares his story to encourage others not to ignore even mild chest discomfort. Now that you know the warning signs and symptoms, let's talk about what you can do to protect your heart. These evidence-based strategies can dramatically reduce your risk of developing heart problems. Get moving. Just 30 minutes of moderate exercise most days can reduce your heart disease risk by up to 30%. Even simple walking counts. Quit smoking. Your heart attack risk begins decreasing the day you quit and can drop by up to 50% after 1 year tobacco-free. Eat heart-healthy foods. Emphasize fruits, vegetables, whole grains, lean proteins, and healthy fats like olive oil, while limiting processed foods, red meat, and saturated fats. Manage your weight. Losing just 5 to 10% of your body weight if you're overweight can significantly improve heart health by reducing strain on your cardiovascular system. Control blood pressure, cholesterol, and blood sugar. Regular monitoring and appropriate treatment can prevent the arterial damage that leads to heart disease. Manage stress. Chronic stress takes a toll on your heart. Techniques like meditation, deep breathing, and yoga can help reduce this burden. Know your family history. If close relatives had heart problems, your risk is higher. Be extra vigilant about screenings and prevention. Get regular checkups. Many heart conditions develop silently. Regular medical care catches problems early when they're most treatable. The human heart beats approximately 2.5 billion times in an average lifetime, faithfully delivering oxygen and nutrients to every cell in your body. Yet we often take this remarkable organ for granted until something goes wrong. The signs and symptoms we've discussed today are your body's way of alerting you to potential heart problems before they become life-threatening emergencies. Don't wait for a heart attack to start taking care of your cardiovascular health. Share this video with someone you love. It might just save their life. And remember, your heart works tirelessly for you 24/7. Isn't it time you return the favor with the care and attention it deserves?